Hi, do you know that spine surgery in itself is a risk factor for developing future spine related problems? No, I'm not talking regarding the patients, I'm talking about the spine surgeons themselves. The spine surgeons, they are at risk for developing spine problems over a period of time, and this percentage is shockingly 40 to 70%, which is pretty high. While doing a spine surgery, the spine surgeon initially has to bend over the patient, flex his neck, and look into the operative cavity. So bending neck forward, bending your body forward, this creates an extensive stress on your spine. Added to that, you will be wearing a heavy lead apron which might be around 5 kilo in weight. This pulls down your shoulders and this adds to your stress on your cervical spine. While doing the important steps like looking into a microscope or using loops, you create an extra effort on your neck by keeping your neck in awkward positions. Even this adds to cervical spine changes which are pretty early compared to the rest of the population. Suppose you are doing endoscopic spine procedures, you have to hold the camera and the equipment in front. This creates an extensive load on your thoracic spine and lumbar spine, and this activity, which is continued over years and years, leads to earlier degenerative changes in your spine. So it can be summarized that the spine surgeons are fixing other patients' spines at the cost of their own spine. They are damaging their own spine to fix other patients' spines. Now you might say they are paid well, so for money they are doing. No, that's not the case. I have a question for you. Suppose one of your friend or very close relative is suffering from spine related condition, say disc herniation, listhesis, and is having immense pain. If you are given a choice of taking the disease onto yourself in exchange for money, will you do it? No, I don't think so. So why do you think a spine surgeon is still doing a spine surgery in spite of knowing that he is doomed? He is at the risk of developing the same spinal condition that he is treating on another patient. It's sheerly passion. We as healers, we get immense pleasure and immense satisfaction when we see our patients healed of their suffering. And that is the reason we are doing it. The theme for Doctors Day this year is Behind the Mask, Who Heals the Healers. This brings attention to unseen emotional and mental problems that the doctors are facing. I may be a bit off topic by discussing the spine related issues the spine surgeons are facing, but I want to end by giving a small advice to all the spine surgeons. Eat healthy, stay fit, exercise regularly, maintain your core strength, and quit smoking. This is how you are going to delay the degenerative changes that you bring upon yourself by doing the spine surgeries. Happy Doctors Day.